My name is Sam Meisler, and I'm a small animal veterinarian. Today we're going to talk about canine atopy. What is atopy? Atopy is a skin condition that causes a dog to be very itchy. The typical areas that we see them itchy are the feet, the sides of their face, and the sides of their bodies. Now, it can cause itchiness other places as well, including the ears. So if you have a dog with chronic ear problems, then atopy may be part of the problem. Now, that's just some of the story. What actually triggers the dog to be itchy? Atopy really is an allergy. And what it means is the dog is allergic to things that it's breathing in or coming into contact with. These can be pollens, grasses, molds, that sort of thing. Fibers, cotton, wool, all those items as well. And this triggers these itchy conditions. Now, how do I treat atopy as a veterinarian? Well, we can treat atopy in two ways, and sometimes we have to use both. One way we can treat is just treat the symptoms, and we find a lot of times we're in the position where we have to do this. And this is when we're treating with antihistamines to decrease the itch, or we're treating with steroids or cortisone type drugs to also treat the symptoms, particularly the symptom of itchiness. On the other hand, we can try to get to the root of the problem and actually treat what's causing the allergy. And you can do this in two ways. One is with a drug called Atopy, which gets to the root of the problem and decreases the immune system's response to these pollens so it won't cause itchiness. That's how Atopy works. It does take a few months for this to kick in, so don't be discouraged if your dog's been on Atopy for a couple of months without effect. Give it a couple months more, 3 to 4 months before giving up. The other way to get to the root of the allergy is to have a test done, and there are two ways to do this, either a skin test or a serum test, to test for the actual allergens that your dog is allergic to. You know, the actual pollens, the actual fibers, the actual components out there in the environment that your dog is allergic to. And you can do that as a skin test or a serum test. From those two tests, one or the other, we do the same thing. We essentially then make up a set of vaccines for your dog to desensitize it against these allergens. So each dog will have its own set of vaccines. And that is what is truly called an allergy shot. Those allergy injections will be given daily at first, then every other day, and then taper down till usually about once a month after you get about 6 months into it. That way is probably the best way to go about it, but it does take time. It may take 4 to 6 months before you see an effect. Meanwhile, you have an itchy dog. And that's where we get back to the first way, the symptomatic treatment, where we may be treating symptomatically while we're waiting for the results on these other tests, and while we're waiting for these tests and their allergy kits that we make up for them to actually work on your dog. But that gives you a basic idea of how we treat canine atopy or canine inhalant allergies.